like outcasts in the community, but feeling incomplete without a child. And so what are the causes of this? And by the way, what can be done? Those are some of the big questions that we are going to be answering today as we discuss infertility and its effects. Now, passionate about helping couples who are facing infertility is fertility specialist Dr. Kireki Omanwa, who's right next to me. And perhaps one of the rarest moments that you'll actually see on television, man and wife openly sharing their story dealing with infertility. Mr. and Mrs. Ominde are here with us. That's Lillian right at the center, and we do have Abednego who's at the far end. Thank you so much for being with us. Okay, so Dr. Harry, we're going to get to you in just a minute, but I actually do want to start with Lillian and with Abednego and actually talk a little bit about your story. So Mr. Ominde, let me start off with you. How long had you been trying as a couple?
Yeah, good morning, viewers.
Yeah.
Don't struggle with Abednego. You can call me Abedi.
Yes, thank you.
Easier.
Dr. was even telling me, I don't think you read your Bible.
Yes. That name is found right in the middle of the Bible. Yeah. So we are glad that we've got this rare opportunity to just come out, not for any reason, but to encourage many people who are facing this challenge, because this is one of the conditions that many people would rather just keep silent about it.
Yeah.
Yet there are many people who are suffering, who are going through such challenges.
Yes.
And I think it's about time that we came out and talk about it.
Okay.
Yes.
So,
yeah. So just briefly, we have been married for the last 14 years.
Right.
I can say 14 uninterrupted years, and we've been fine. Now, the issue of infertility is one thing that does not come out in any of your plans.
Yeah.
You never plan for infertility. It never appears anywhere. But then it just comes out and you feel like, now there's a problem. Like, I think being married for the first year is a honeymoon.
Yeah.
The second year, you're like, what's not happening?
Yeah.
And then I think we... maybe just take you through our journey. We started seeking medical attention.
Yeah.
I think after 2 years, then we said, what's not happening? Just going through the tests and such like things. And we were told many things.
Yeah.
We were put, actually, we were tested, both of us. And actually, both of us did, the first tests found that we were okay.
Yes, until?
Yeah, we were okay. We were told just continue trying and just continue trying.
Okay.
All of you are okay. Until later, I mean, we're put on fertility medications. I think that Tari can mention some of those. Yeah. Yeah, just to enhance the chances of getting pregnant. And then thereafter, I think after like 3 years, yeah, she conceived. But then after a few weeks, it was discovered it's an ectopic pregnancy. Okay. Yeah. I think that I will also explain more about ectopic pregnancy, yes. Okay. And then, yeah, thereafter, I think we had, I think, 2 situations of miscarriages. Yeah. And after 6 years, that's when we were able to get a baby. Okay. And then thereafter, after the second miscarriage, then we were told that we cannot have a baby naturally. Okay.
Yeah. Lillian, how did this make you feel? Look at, you know, he's mentioning the years and the years. What was going through your mind?
Of course, it was not easy for me.
Yeah.
You know, every time you look at other people, they're carrying their babies.
Yeah.
And you're just there. You don't know what is happening. The doctors are saying things are okay, but you yourself, there's that feeling. Yeah. Why am I not conceiving? You know. So it was not easy for me.
It was not easy.
It was not easy.
And you know, in most cases, you always hear it is mostly, first of all, the woman, because we always start there. But of course, there are cases whereby it could be the man. But in this particular case, was anyone actually found to have been the issue?
At the first time, we were both okay. Yeah. But after a while, the doctor said that I had a problem. I'm the one now with the problem. So we had to take medication. Yeah. But it didn't work. Yeah. It didn't work.
It didn't work.
Yeah.
Doc, like I said, very rare to actually find couples coming out, especially from the male perspective.
Absolutely.
Even a man saying that, by the way, okay, we are having this particular issue, it's not easy.
Actually, number one, let me start by commending this couple for coming to the studio, for coming out and saying, you know what, we had a problem, and we had it solved. Especially for Abednego, because men generally don't come out. We may have problems, but we don't talk about them. I think it is the way we have been brought up, we have been socialized, that men don't have problems. In this case of infertility, women are the manifestation of the fruits of the labor that has been done. Now, if there is no pregnancy to show that actually you are okay, then the problem from the society, the problem is the woman. But sometimes, or even quite a number of times, about 30, 35, sometimes even up to 40% of the reasons or the causes of infertility actually lies on the man. So number one, let me thank profusely Abednego and Lillian for actually coming out and saying, yes, we had a problem, and we had a struggle, and we went through the normal routine diagnosis, treatment, and so on, and there was success after that. Because this will be an encouragement to other couples,
I agree.
Definitely. So it's a big applause for you to come out publicly and say, actually, we had this issue and we had it solved.
Abednego, tell me, did this really bring a strain in your marriage? Was there a point that this really was the center of perhaps maybe a dispute as a couple?
As a couple, I think we did have a problem. And when I look back, I think through this experience, it brought us really together and helped us to build a strong foundation. But mostly the issues come from outside. I must say that, like, we had very supportive parents. But now this support from our parents sometimes can end up being strenuous. For example, you know, like my mom will be like, no, my daughter, you'll be okay. Take this, you know, the traditional medicine. Drinking jerrycans of those madawas. Please try this. My daughter, you'll be okay. Take this, take this. So, you know, that alone, I mean, in the eyes of my mother, she's very positive. She's supporting us to be able to go through this journey. But again, it also brings in a lot of, you know, it is, I don't know, maybe, you know,
friction.
A bit of friction.
Or a
friction. I mean, there is that, you know, you're doing something positive, but again, it is also bringing a lot of pressure on us. And then, you know, you're trying this. We say, okay, no, just wait, we're trying this. You know, everybody is giving you, you know, other things. And of course, the major challenge, again, as I said, from outside, is also from friends, from the people that you associate with, and all those.
But you know, even Lillian, woman to woman, you can imagine just on the inside how you would be feeling. And when we talk about a woman not being able to have a baby, it can drive you crazy.
Yes, it can. It was really, I don't know how I can put it, but ilikuwa mzigo. Especially when your friends are asking, Kwani, what is not happening? Why are you not? Why are you not getting pregnant? Look at our babies, they are growing.
As ours will be in college, where ukianza.
Ukianza, si unachelewa nini unangoja, unajua. It was not easy. It was not easy at all. But I thank my husband. He has always been there for
the patience and the support.
Okay,
we want to let our viewers know that, by the way, you are free to actually call in if you've got any questions, especially even a word of encouragement to our couple who are here in studio. Go ahead and get in touch with us, and hopefully we'll be able to answer some of your questions concerning infertility and its effects. Doc, this brings us to the question, is there really a definite cause of infertility?
First of all, maybe we can start by defining what infertility is. According to World Health Organization, infertility is the inability to have a child, to have a pregnancy. And it is actually divided into two. There is primary infertility, whereby you are in a relationship, you have regular intercourse 2 to 3 times a week, you're not using any contraception, and 1 year has passed and there is no conception, there is no baby. That is primary infertility.
Okay.
Now, in the case of Abednego and Lillian, they had a pregnancy. There was a miscarriage, there was an ectopic pregnancy, and so on. So in their case, it was actually secondary infertility, whereby there has been a pregnancy before, or there has been a baby, and you're trying to have another baby, and the same time span of 1 year has passed, regular intercourse, there is no contraception, and she is not, the lady is not breastfeeding, because breastfeeding can actually sort of work like contraception in most cases. So in their case, it was secondary infertility. Now, he said that there was no problem. The first time they went, all of them were checked and everything was fine on both sides. Sometimes it can happen that way, but thankfully that is a very, very small percentage, about 3, maybe 5%, whereby everything is okay. We actually cannot pinpoint out the reason why a couple is not getting pregnant. However, when we start now, when a couple comes, they've been trying to get pregnant, it hasn't happened. Obviously, the first thing we want to do is we want to take the medical history. We want to take a medical history of the lady, the medical history of the man, whether there have been any surgeries, whether the periods are regular, and so on and so forth. For the man, again, on the other is also we need the medical history as well. Now, once we have done that, then we can come down and, you know, do some tests. But some of the reasons for infertility, I think we'll start with the ladies. Ladies first.
Yes.
So in this part of the world, in my practice, I see one of the biggest problems we are having is blocked tubes. About 80 to 85% of the cases that I see actually have blocked tubes. And the reason for blocked tubes most of the time is because of either they had some infections, sexually transmitted diseases, or they had surgery, which led to a blockage of the tube. Now, there can be a blockage of the tubes plus accumulation of fluid in the tubes as well. In our ladies, ladies of African origin, we have issues with fibroids. We have fibroids, different sizes of fibroids, but the biggest problem is the location of the fibroid. If it is in the what we call submucosal, that is where the baby implants and grows, that is going to be a hindrance for a baby to implant. There's a problem with what we call endometriosis, whereby a little bit of the lining of the womb actually is implanted elsewhere. That becomes a huge problem. About 30% of the patients who have issues with infertility actually have a problem with infertility.
Let me just stop you there for a second, Doc, because we've got Mwangi from Nairobi on the line. Good morning, Mwangi.
Good morning.
Yes, go ahead. Do you have a question or a comment?
My son had an undescended testicle. And he underwent a surgery at age 2. So I want to know if this can bring some problems in future about fertility.
Thank you so much for that. Asante sana for that. His baby has actually gone through surgery at age 2. Could there be problems in a few? So you'll answer that as you get to the male infertility part and know what men actually go through.
Now, when it comes to the males, there are issues as well. There are issues with blocked tubes as well. Because in the males, there are tubes which actually bring down the sperm so that it can be ejaculated. Those tubes can be blocked for whatever reason. Because of surgery, they can be, inadvertently be blocked. They can be blocked because of infectious diseases. And in such a case, you find that this gentleman will have an ejaculate, but may not have any sperm in the ejaculate as well. Now, some of the reasons, apart from the blocked tubes, the surgery that I have mentioned, undescended testicles. Now, usually, in a child, in a boy, these testicles actually go down and go into the scrotum. But sometimes one or both of them may not descend. So they are usually brought down surgically, because if they are left where they are in their canal, later on there can be problems with cancer.
Maureen from Kasarani on the line. I don't know if we've lost her. Do we have Maureen? Okay, all right. We've lost Maureen, but hopefully we'll get her back. Okay, so that could actually cause issues later on in life.
It can be a problem.
All right, so in this case, Mr. Mwangi's son,
yes.
Do you think there could be issues later on in life for this boy?
What I think is that he didn't mention whether both of them are undescended or it's only one. That is why we are made in a fantastic way, that in case one is not functional, in the case of Mr. Mwangi, the other one is functional.
Okay.
So he may have or he will have sperm which we can use.
All right, and gentlemen, listen to this. When we were talking with Doc prior to this interview, we talked a little bit about the quality of sperm.
Very good.
Wow. Okay, before you talk to us about the quality of sperm, Jacob, I understand, is on the line. Jacob, good morning.
Hello.
Yes, Jacob, good morning.
Good morning.
Yes, question or comment?
Nilikuwa nauliza.
Yes.
CS inaweza cause infertility in women.
Sorry, Rudia?
CS. Cesarean.
Yes. Okay, asante sana. I'm asking if a cesarean section could even be the cause of infertility. All right, we'll get to that. We were talking about the quality of sperm and why it actually matters.
It matters a lot.
Yes.
Because when the gentlemen come, and they have issues with infertility, what we want to know is the quality of the sperm.
Okay.
It's a simple test.
All right.
The gentleman gives us a sample, and we analyze it.
Okay. Pamela from Thika is on the line. Good morning, Pamela.
Good morning, good morning.
Yes. Do you have a question or a comment?
Yes, I have a question.
Yeah.
I wanted to ask Daktari about the adenospermia. Yes, what is the motility part of men?
Okay.
And my husband has been undergoing the treatment.
Sorry, we are losing you, Pamela. Can you repeat that again?
I'm asking about the sperm motility.
Motility.
Okay. All right. Thank you.
Yes. Because he has been having a problem. We have been trying for the 4 years now.
Okay. Thank you so much for that. All right. Sorry?
Hello?
Kerubo. All right. I understand we've got Kerubo as well on the line. Good morning, Kerubo.
Morning to you.
Yes, go ahead.
Niko na shida kupata mimba. I've tried for almost 7 months now. Niko na firstborn na 5.
Yes.
But now I'm looking for secondborn, but imekuwa ngumu. Yes.
Okay. Thank you so much. Daktari will answer that for you in a few. Thank you so much for that. All right. So you said that we actually go ahead testing, or rather you go ahead testing the gentleman's sperm.
Gentleman's sperm.
Okay.
It's a simple test.
Yes.
But for men, it can also be a very difficult test because usually, as I said, men are not supposed to have issues.
Right.
Now, when they give us this sample, there are several parameters that we look at. We look at the volume of that ejaculate.
Yeah.
It's supposed to be at least 1.5 milliliters or more. We look at what we call the concentration. That is the number of sperm in 1 milliliter.
Yeah.
It's supposed to be 15 million or more.
Right.
The more, the better.
Okay.
We look at the count.
Yeah.
That is the total number of sperm in that sample. It's supposed to be at least 40 million or more. There was a question about motility.
Yes.
Somebody asked about her husband having issues with motility.
Yeah.
There are different types of motilities.
Okay.
Where there's type A, which swim very fast. I would call that the sprinters. 100 meters, the sprinters.
The Usain Bolt.
The Usain Bolt.
Okay.
And then there is type B,
yes,
which also, okay, they swim well, but not as fast as type A. So those are the Kenyans, the long distance runners.
The long distance runners, okay.
So when you put both of them together, A and B together, they should be at least 40% or more.
All right.
We look at something called agglutination, meaning that the sperm should not be sticking together at all. Okay. And they can stick together head to head, head to tail, or tail to tail. Okay. This can be a problem. All right. And then we also look at, number one, we also look at the white blood cells. They're not supposed to be more than 1 million. Okay. Because if they're more than that, it means there is an infection somewhere. All right. They are not supposed to be any red blood cells at all. Okay. Because it means that there is a bleeding somewhere. We are not also supposed, and then we look at the morphology. Okay. At the percentage now of this sperm, which are normal. Okay. And it's supposed to be at least 4% or more. All right. Okay?
Okay. Let's take a short commercial break, Doc, because we've got quite a number of questions that we need you to answer. But we're still asking you to send in your questions. You can also get in touch with us through our social media platforms or via SMS, if you will, 21222. If you prefer to call, the numbers are at the bottom of your screen. Do you have any questions? Do you have any words of encouragement? We still do have Abednego, I said it right, and Lillian Omin.